Vicky. I'm a physiotherapist working with patients with long-term fatigue problems and most recently patients suffering from post-COVID symptoms. I just want to talk a little bit about today about the general presentation of the post-COVID patients that we're seeing and why the symptoms present the way they do. So with symptoms following a severe viral illness such as coronavirus, we are seeing daily symptoms which are not alleviated in the usual ways we would expect to see following a virus. And with symptoms, the body uses symptoms as a way of telling us there's a problem. So usually we get symptoms if our body's struggling in some way, or it's fighting an infection, or there's a problem, and they're warning signs really to tell us that something's not quite right. So we often use the analogy of the dashboard on a car. Normally you would drive your car and there would be no problems at all. But if there is a problem, you get a warning light and you stop, you sort the problem out and the light goes out and then off you go, no problems again. Now, the body's a little bit like that. We always try and think of the body a little bit like it's a machine, just a complex one, but it gives us warning signs when it needs to tell us there's something wrong. Unfortunately, what we're seeing with long-term conditions such as post-COVID is that we are starting to see daily symptoms with very minimal or no activity levels, and therefore this makes it difficult to manage those symptoms because it's hard to understand what's triggering them and causing them to initially emerge, but also why they continue to present. So it's a little bit, again with the analogy of the car, it's a little bit like you're getting in the car, you're driving a couple of metres down the road and all of the warning lights are coming on straight away. And even when we check all the different parts of the car, there doesn't seem to be any major reason why all of these warning lights need to be on at the same time. So, as a human being, as that machine, we're checking out why all these symptoms are happening. We can do blood tests and scans and all sorts of medical investigations, some of which may show some anomalies, but lots of these symptoms are not actually triggering any positive results when we do investigations to give a reason as to why they are persisting in the way that they do. And what we've come to understand when we look at post-viral fatigue-based illnesses, we seem to see a picture as if the body's got itself into a very hypersensitive, overprotective mechanism where it's using symptoms on a daily basis to keep people as restricted as possible, to prevent them doing any activity, almost as if it's trying to preserve all of its energy to be fighting off or recovering from the initial virus or cause of the problem. And therefore, every single day, regardless of how much sleep you've had, you feel like as soon as you try any activity, the symptoms come on, they're very varied, very severe, and obviously stop you functioning and stop you carrying out the activity that you want to engage in. Now, as a human being, we are only able to engage in 4 types of activity, okay? So we can engage in physical activity, which is very easy to understand because I think we all recognise that physical activity uses energy. If we get up on a morning, we get dressed, we brush our teeth, we walk downstairs, we eat our breakfast, all physical activities all use energy. And I think with physical activity, it's often the first thing that we stop doing when we don't feel well. I don't feel too well, I'll sit down. I feel really unwell, I'll lie down, okay? So physical activity is probably the easiest one to manage and the easiest one to understand. Along with that, we do have to remember as well that eating is a physical activity, so digestion uses huge amounts of energy. Again, we all recognise that, Christmas Day we eat a huge dinner in one go and then we're so exhausted afterwards we fall asleep on the sofa. When we're talking about a condition like a chronic fatigue-based condition such as long COVID, what we see is even with a small amount of food, as soon as that food hits your stomach, your body starts to digest that food. That uses a huge amount of energy. So eating can be an exhausting task. And that can often make it more difficult to kind of follow a healthy diet because it's so tiring to have decent sized meals. So physical activity is our first type of activity. The second type is our mental activity. Again, fairly obvious, if you're using your brain, it's obviously going to be using a lot of energy. If we are filling forms in, if we are sat trying to work at a laptop, or mental activity. But it also includes the less obvious that we have to remember. So it also includes things like watching TV, going on the internet, so Google, Facebook, Instagram, Snapchat, those sorts of things that we engage in to maybe just pass the time because we're not well enough to do other things. Very much mental-based activities that are high energy tasks. They use a lot of our energy, and we need to remember that, because when we're unwell and we're spending a lot of time trying to recover, it's very easy to spend days lying in bed or on the sofa, and because there is nothing else to do, the only thing we've got to do to pass our time is TV, internet, Netflix, online investigations. That is a huge amount of mental activity. And often people will say, I'm barely leaving the sofa, I'm barely leaving my bed and I feel no better. But actually, they're still engaged in high levels of activity. It's just more mental activity than physical activity. So we've got our physical activity and our mental activity. The next one is our social activity. Social activity uses a lot of energy. So interacting with other people is exhausting. Some people are more exhausted to interact with than others, but in general, having to listen and react to conversations takes a huge amount of energy. So interacting with family and friends, very, very tiring, will use a lot of energy, will affect your symptoms. And what we'll find is that as the day goes on, you'll start to find more and more activities becoming more and more difficult because your symptoms are increasing as the day progresses. So we've got physical, mental and social activity. The last one is our emotional activity. So our emotions use a huge amount of energy, and the general worries of the day, we all have them. I don't think anyone can go through life without any worries. Usually there's something that we can concern ourselves about. That all uses energy. When you have a long-term health problem, and that brings about anxieties about symptoms, it brings about anxieties about the future, about finances, about family, that's a huge amount of worry and emotion going on throughout the day. So we can see that throughout the day, from the minute we wake up until the minute we're back asleep at night, it's constant activity, and it's a mix of all four types: physical, mental, social and emotional. And I tend to picture them a little bit like sort of those cooling towers that can go up and down. So I would tend to say to people, think about the types of activity you're engaging in a day and how much of that activity that day has involved. So if you are having to get up and about and you're trying to push yourself to go to work, to move around, if you're in a physical type job, you're probably using a lot of physical activity. You may not be using as much social activity if you work on your own. You may not be using as much mental activity if it's a physical based job. If you're in the house and you're not at work and you're very unwell and you're lying on the sofa, you're lying in bed because you're very limited in what you can do, your physical activity is going to be very, very low. Your social activity may be very, very low if you're in the house on your own. If you're trying to pass the time by using the internet or watching TV, box sets, whatever, your mental activity will actually be very high. And although you're not moving around and you're not doing anything, the energy used is just as much as if you were doing other types of activity. So we need to recognise all four types because they all have equal impact on our symptoms. And what we tend to see is the body is incredibly clever at how it uses symptoms. So it's very good at choosing symptoms that are appropriate to the type of activity we're engaging in. Now, if you're doing a physical task and you're on your feet and you're moving around and the body wants to try to stop you doing that, it will pick symptoms that it knows are going to make that task as difficult as possible. So if you're on your feet and you're moving about, the best symptoms it can send are going to be things like fatigue, pain, dizziness, unsteadiness, because they're brilliant symptoms that make you think, I need to sit down. Because if I don't sit down, I'll fall down. I've got to stop what I'm doing and sit down. And if you keep pushing, those symptoms will increase to the point where you have no choice but to sit down because they're so severe, you know you can't continue to do the task. Now, if you are engaging in a mental activity, say you're watching TV, the symptoms needed to stop you doing that are different. So the body needs a different tactic to make those symptoms more appropriate to the type of activity that you're doing. So we see a different set of symptoms sometimes that can appear. We see things like not being able to follow the television programme, can't concentrate on what's happening, can't concentrate on what we're doing. Too bright, too noisy, the screen not tolerable. And therefore we start to see that activity is becoming so difficult that people think, I'm just gonna stop, I'm gonna switch it off. If you're using your phone, you might find that actually you get to the point where it's hurting to hold your phone, it's hurting to press the buttons, you're making mistakes in what you're doing because you can't focus properly, you're clumsy in what you're doing, and that can be a real difficulty. If you're trying to listen to something, you're not taking the information in, if you're filling a form in, you can't follow what you're doing, your hand's sore, all brilliant symptoms that make it really difficult for you to carry out that activity, so make you want to stop. In the same way, if you're engaging in social activity, if you're doing social activity and you are trying to talk to people, follow a conversation, then you start to notice symptoms creeping in, and those symptoms could be things like you forget what you're saying, you can't remember what you're talking about, you're repeating yourself, you say the wrong word. Really good symptoms from the body's point of view to make you think, I need to stop this, I can't carry on the conversation, I can't follow what I'm talking about, I'm going to have to end it. So again, the body can use those symptoms really successfully to stop you engaging in that activity and make it impossible for you to continue, therefore you leave it and you move away from it. And this is the pattern we see with presentations such as long COVID. We see constant symptoms, often targeted towards the activity that you're doing, that make you think, I just can't do this anymore, I feel dreadful, I'm going to have to leave it and I'll move on to something else. I'll put that away, I'll just put the TV on, but then I can't engage in the TV, so I'll put that down, I'll pick up and look at my phone. Can't engage in my phone, I'll put that down, I'll try something else. Until we hit the point where you think, I can't engage in anything, I'm just going to have to sleep. And then we end up with having to have daytime sleep to recover from what we've done, therefore making us obviously impossible to function through the day in a normal fashion. So we're seeing definite patterns and definite links between symptom types and activity types. I think this is the first step when we're starting to manage a condition and symptoms of long COVID. We need to start to acknowledge why our symptoms are occurring, what's triggering them, and the links between our symptoms and our activity.